How long to take BPC-157 for injury? Now, I don't know if you've experienced pain, but I have a no pain policy. Maybe that's just because I'm weak, which I probably am, but actually I've learned to ignore pain over the years. An adrenaline junkie, grew up on a cattle ranch in Idaho, raced dirt bikes, a lot of football injuries, a lot of injuries in basketball, broken bones, and I can tell you I do not like pain. And BPC-157, if it was a peptide that I had in my youth, oh man, I could have accelerated the healing so quickly. So in this video, I'll unpack exactly what not to do when it comes to BPC. You don't want to stop short of success. But the secondary thing I'm going to show you is the difference between acute injuries and more long-term chronic injuries. I'm Regan Archibald. I'm the founder of Ageless Future. My job is to help people get as healthy as possible in the shortest amount of time possible without risking your future health. And I've created a whole system, it's called Ageless Future Operating System, that allows you to put in your own personalized body operation system. And peptides are one of the features of this overall system. And so today we'll talk about BPC. What is it? It's a pentadecapeptide, which is a fancy way of saying it's a body protective complex, or BPC-157. It was discovered in the 90s, and every time I research it, I'm more and more excited about this beautiful molecule. So if you have an injury, how long do you take it? Well, if it's a mild sprain, and I'll share with you some of the research, maybe 2 to 4 weeks. And how much do you inject? Well, you can do as much as an entire milligram, but most of the time just 50 micrograms, even 25 micrograms, especially if it's in an ankle, is going to saturate the area and get you the expression of those VEGF factors, the vascular endothelial growth factors. You're going to get these fibroblasts that turn on so your tendons can start recovering. But 2 to 4 weeks is typical. And this is not medical advice, so talk to your doctor when it comes to what's appropriate for you. But if you do have something that's more chronic, then you may want to be on it for 90 days or more. But one of the things that you can assess is, mild tendon sprain is way different than if you've had like osteoarthritis or like some overuse issue. The great thing about BPC-157 is it is anti-inflammatory. It causes a greater expression in your growth hormone receptors. So your body, if you've got growth hormone in the area where your body's damaged, you seem to heal faster. BPC modulates dopamine. It also is very protective from a neurological perspective. BPC has been shown to increase nitric oxide and angiogenesis, so you get better blood vessel formation into the areas that are damaged. So one of the worst injuries I had, I was snowboarding at Park City Mountain Resort, and I had 2 choices. I could either hit a tree or hit a skier. And I had a skier cut right in front of me, and I chose to take out the skier because I love trees. And when I got up, my shoulder was wrecked. The skier was just fine. I pushed him out of the way, but then it sent me tumbling. I learned the next day I had a full thickness tear in my rotator cuff. I broke my clavicle and my scapula, and my labrum was torn. And so I tried natural therapies for 6 months. And this is where I learned about stem cells. And so I have perinatal stem cells, and technically these are signaling cells. So I just used the same raw material that I grew in my mother's womb from, which is the perinatal tissue, and we injected it, and it healed my shoulder. It was amazing. I wanted to test the hypothesis. So skateboarding, I tore my other shoulder. We did the same treatment. This was a few years later. He healed my other shoulder. But this one, the difference was I had BPC-157 that I utilized in conjunction with the regenerative medicine. My right shoulder, which the thickness tears were roughly the same. The only difference is I didn't have a bone break in the left one, so we could argue it wasn't quite as severe, but it was actually more painful. But the fact that I used BPC-157, I saw my time to result where I could actually have full range of motion, and I could start doing some push-ups and pull-ups and lifting weights. It was a month on the left shoulder versus about 3 months on the right. And yes, I'm an N of 1, and I can hear some of your scientific brains go off off like, yeah, this is not a clinical trial and there's no placebo. You could have just healed on your own. I can tell you that I tried everything natural on the right shoulder for 6 months. Nothing was touching it. So that seemed to get me to the next level. But just so I could know for a fact that it would help my torn rotator cuffs, I was skiing with my sons at Deer Valley, and I took up skiing because we moved in a town called Midway, which is the coolest town. It's just this little hallmark town that developed by the Swiss. And I was skiing at Deer Valley and tore both rotator cuffs, ski poles bent, the whole 9 yards. And when I had the MRI, the radiologist was like, hey, Regan, it looks like you've had surgery on both of your shoulders. And I was like, no, that's regenerative medicine and BPC. We actually saw it. And then I did the same treatments with BPC, thymosin beta-4. And once again, I had both of these shoulders recover in about a month versus 3 to 6 months in my other shoulder. So when you're considering this, I was injecting 3 days a week. So pretty much every other day I was doing injections of BPC, and I was using 500 micrograms in the injections. On the days where it was more acute, where I've had other injuries, I'll go up to a full 1 cc, so a full ml BPC-157. And I'll inject that until the acute pain is gone. And in some cases, if it's very acute, you can do it every day, but you may not want to do that large quantity. And then in injuries that are more, less acute, it's every other day, 500 micrograms seems to be the sweet spot. 2 to 4 weeks is what you'll need. But most of you, once you're out of pain, if it's an acute injury, then maybe you inject it 1 or 2 more days just to make sure it's solid, and then you can get back to what you're doing. And then you can reduce the dose, do more of a maintenance dose. But if it's something that you've had for years, especially if you've got back pain, low back pain is devastating. I mean, not only does it cause our brains to atrophy and age quicker, but low back pain also is not easily identifiable. Like, where does it come from? Sometimes you do an MRI and your back looks great, and it's like, why do I have pain? But BPC-157, what we do know is the fact that it can downregulate some of those pro-inflammatory molecules in your body. You just find the sensitive spot and have someone just use a little insulin syringe and inject it into the area. But if you work with a doctor, which I would recommend on this, don't be injecting into injury sites. You can just do subcutaneous injections, and the BPC will activate all the genes anyways. But if you can get a skilled doctor, you can actually place the BPC very close to the area where you've got the injury. And that's where you'll get the greatest benefits. And in some cases, you may need to go twice a week and get an ml of BPC into the areas of the spine. Once again, on the spine, only work with a prescribing physician, somebody who is skilled in injections. We use an ultrasound. My providers use ultrasound imaging. Make sure you're doing this the right way, but it may take you, if you have like a disc herniation, maybe you've got some kind of disc degeneration, maybe stenosis, then plan on about 8 weeks of twice a week. And then also consider doing some other regenerative therapy. Maybe it's alpha-2 macroglobulin. If you do have degenerative disc disease, it's a treatment similar to PRP, a different filtration system. Maybe you need PRP. Maybe it's plasma, umbilical cord plasma. But put some regenerative properties in there, and then you can cut your time in half, which will save you a lot of money. More importantly, it will save you a lot of pain, because time is the one resource that we don't get back. And pain is a thief of our time and our attention. It's distracting. It limits us from doing the things that we love to do. So if you're looking to utilize BPC-157, you want to get help with your pain, we have a no pain policy. So we're going to help you get out of pain as quickly as possible without risking future health, and do it in a way that is based on your own physiology. So the very first thing you want to do is go to agelessfuture.com, set up a meeting with one of our regenerative medicine specialists, and they'll find out what treatment's going to be best for you. I appreciate you being on this channel. I'll see you in the next show. I'm Regan Archibald.